Okay, so we've got the depot, and then we can also inject either in the muscle or in under the skin as a weekly injection.
Yeah, so to try and overcome that whole overshoot, undershoot type of scenario, the ideal way would be to do a daily injection. But obviously, with the daily injection, you'll use the same dose, but you'll give it in smaller amounts in a daily dose, say subcutaneously. But it's not nice injecting yourself every day. Yes, it doesn't sting that much, the injections, especially if you're on the low dose. If the dose goes up slightly higher and you do less often injections, it's a higher dose and it might sting more. But you mimic the natural pattern if you do a daily injection. It's just not practical. It's difficult for anyone to adhere to something that they need to inject themselves every day. Hence why the 3-month injection is so popular, because it's a one injection and then they don't think about it again. But there's better ways to get the levels at a more constant, natural way. So one of the things that we can do is we can use something like a cyprinate, and which we can then either give a bi-weekly or 3 times a week injection subcutaneously with lower doses, but the total dose will be the same as what you would have given in another way. So, and then you get a pretty much a almost natural type of pattern in your levels.
Yeah, and again, 3 times a week injection. And I don't know if anyone has seen what a testosterone injection looks like, but it's quite a fatty compound trying to pull it up into a needle and a syringe and then trying to give it to yourself.
Yes, but that's the problem. I mean, it's a very viscous type of medicine, and to give that injection is not easy. Hence why we moved to the creams or the gels.
Yeah. I wanted to say then the other option these days are a gel, a patch, or a cream.
Yeah, and they can do pellets as well, but yet again with the pellets it's also it's very similar to a depot type of method.
Yeah, and you have to go under the skin. So and then coming back to why we're thinking that's the best option is you don't break the skin, you can give it every day. Very easy to travel with, doesn't need to be in a fridge or anywhere that light can be an issue. So it's actually very easy. It's like taking your toothpaste with you. So that's the pro, that it can be made for you. It's bioidentical, done by either a lab or a compounding pharmacy. But obviously with everything, there's pros and cons. So one of the cons is it can be variable, the absorption. So you need testing to see where you need to be.
Yes, and obviously transfer. So people are concerned about transfer. So if you rub the cream onto your skin and then you hug your kids or your wife or what, then it might transfer the testosterone to their bodies. Yeah. So you just need to be aware of that. And things like you don't want to have a shower just after you've applied the gel. So just timing-wise, you just need to think about how you're going to do it. But from the way the cream works, it's nice that within about 2 to 3 hours you get your peak level. And then we advise men to rub it in the morning so that you mimic the morning peak that you get in a natural way. And then it will also decline over, depending, 8 to 16 hours, depending on your absorption and your specific body. Meaning that through the night you will actually have quite lower levels, and then the next morning you can apply the cream there. So you get that cycle, which is very similar to a natural cycle. You're less likely to switch off the axis. You're less likely to overshoot, and hence less likely to get an increase in hematocrit and things like that. So it's a nice way of giving it, but it's a little bit of playing around at the beginning to find the right strength of cream that we can use. And that's why we use a compounding pharmacy, so that we can make the cream exactly the right strength that you'll need.